Hi, everyone. My name is Jason Newland. I'm a pediatric infectious diseases physician at Washington University in St. Louis and at St. Louis Children's Hospital. I'm happy to be talking to you today. I'm an avid swimmer, actually a member of the CSP Masters Group, and love the sport. I have a son that swam, and I just wanted to give you a little announcement on having your children get back to sports and being athletes. There's been a task force put together to look at and make sure that all of our youth sports are getting back safely, and I've been working with Mark and Dave in trying to help and not trying, but actually creating a safe environment for your children. Now, there's important things to know. Number one, children are very mildly impacted by disease. Now, we do know of some severe disease that has occurred, those with more underlying conditions, but overall, it's been a minor disease. But what we also have learned recently, and it's become more and more evident, is that the fact that children haven't been able to do a lot of the activities, including school and sports and other activities, that they've been significantly impacted. And so with these two notions, that one, that the children are mildly impacted, and two, that they're losing out on many opportunities, we believe it's now time, because of our caseloads being low, that they should be getting back to be experiencing the things that will benefit them the most. And I think one of those is swimming. Now, in order to do that, it's not back to normal or back to what we had before, but we have to do things to protect those most vulnerable, which often are our coaches and other people in vulnerable groups, which are usually the adults. And so things have been put in place to do that. What I'd like for you to remember most is the first comment I'm going to make right now, and that's we have to change the culture about what happens when we're sick. That means if we're ill, we have symptoms of cold, runny nose, cough, fever, we don't go to work, we don't go to practice, we don't go to school. That has to be the new mentality as we go forward in our lives. And that is paramount as we get back to swimming for our children. Now, with that, there are a lot of things that can be done and that have been engineered by CSP, Dave, Mark, and the whole staff to make it safe for your swimmer and for you, and so that they can benefit greatly from the practices that, as crazy as it seems, I bet you they miss. So what are those things? No, number one, health screening. There's been things put in place to screen your athlete for symptoms. And the key to this is that we're being mindful and understanding whether or not someone's sick. And if they're sick, we need to not have them come to practice. And that's what the screening's for, so that we can do that and make that. Number two, we believe in masks, right? So there's going to be times as we're getting in this, right? We're now having people come together that we're going to wear the mask. The children are going to wear the mask. We know that the CDC recommends down to the age 2. And so there's going to be some conditioning of the younger children, and we're going to want them to wear these masks as they're coming into practice. Now, we're not wearing masks when we're doing our dry land activity. We're not wearing masks when we're swimming, obviously. But that's going to be key. Number 3, social distancing, social distancing, social distancing. I know that's been engineered, and that's going to be maximized, and that's going to be looked at continuously. And so these things will be key. Now, there's the other things you've heard about. Washing hands will be ample opportunity for that. You know there's not going to be the locker room unless necessary, so we're not going to have congregating in those areas. And the lanes where they're swimming have been engineered, so there's not going to have that social distancing is maximized. So these things are in place. Your children and the staff are going to be safe. And lastly, we have to remember in these times is that as we start to do more, there is a risk involved. And that's still hard, I think, for all of us, is that we know there's risk. And there is still a little risk. There's a risk having our children go back to play sports. I have a daughter going back to play soccer, 2 daughters doing that. I'm okay with that risk at this point, knowing that things have been put in place for that. That's the same here. So you have to take that decision as well, is that there is some risk there. I think it is absolutely very small, and that with that small risk, there's a great benefit for our children, for our youth as a whole, as for swimming as a whole. And I think that we'll be continue to monitor this, and I'm looking forward to working more with CSP as things move forward.